So here's just a few very general tips on how to help pass your neurology examination station in PACES or any clinical exam for that matter. I used to think that failure was a random process and extremely good doctors would fail and I wouldn't understand it. But actually, I'm not so certain that failure is random anymore. And actually, it's just that the PACES exam is testing a very specific skill set, which is very different to what necessarily makes a very good doctor. Um, but there's just some key things that can help you kind of avoid things that make people fail. And as I said in my previous video, so PACES is a very artificial situation and not at all like clinical practice. You know, you're only asked to examine someone's kind of upper limbs, a certain cranial nerve or lower limbs, when actually you need all that information to be able to formulate a precise diagnosis. And from an examination alone, you can only localize where an issue is. And then from that, you can offer only a very broad differential diagnosis because you don't have history to know about underlying causes. You need history for further information. So you should only really focus on what it is that you can get from an examination at PACES to then present a broad differential diagnosis and investigation and management plan accordingly. The key thing to be aware of is that PACES is about doing the basics well. So your examiners won't examine their own specialty. Your examiners for neurology won't be neurologists. And it's likely that the peak of their neurology knowledge was on the day of their own PACES exam, and you're at that level now. They obviously know the diagnosis, which is a big help. But all you need to do is do the basics very well. And people can get lost in trying to kind of be a bit too fancy in reaching precise diagnoses, which, as I said before, is impossible if you don't have history. So you just need to do the basics well. And there's some kind of core key things which people often kind of trip up on, which are what you should focus on doing for your neurology stations. And so I spent a lot of time thinking about how to approach neurology in PACES, both from my everyday work in neurological clinical practice, but also from a lot of teaching that I do, both for people in the hospital and on courses. So, where people who I know are extremely good doctors and know their stuff, but don't necessarily show that, and they're not showing their best self on the day of the examination. And so I've put together kind of a course of talks which hopefully provides a fully comprehensive list of things, but in a really concise manner. And it's kind of teaching neurology in a way that I wish I'd been taught earlier. So I fell foul of learning things in a very fragmented kind of case-based fashion. But that doesn't work for neurology. You need a structure to piece things into, and particularly for PACES, because you have such limited information from an examination alone. You're only examining a quarter of someone's nervous system, and so there's slight limitations to exactly what you can tell from the examination. So if you're trying to be more fancy and do what's not possible to do from the exam, then you can fall foul of that. So it's just doing the basics well is key. And so I'd recommend kind of before going on in-person courses and before bedside teaching, having a really good look about having a very structured framework for how to think about neurology and how to piece together the signs and the diagnoses and where they fit within the broader kind of framework of neurology, not just using case-based learning, at least in the initial stage. So when you're seeing cases on the wards or on courses, you need a structure to know where to slot things into and how to kind of present that to an examiner. So it's important to do that before your bedside practice in order to get the most out of it, because otherwise people can get quite confused ideas. And as I say, you need this kind of groundwork in place, which I'm hopefully trying to provide. This isn't just for the exam. It's important to help your general understanding of the approach in neurology as well. I just reiterate that this is all stuff that I wish I'd known way earlier, because I wasted lots and lots of hours with kind of slightly unstructured teaching. But here I try and put it together in a much more time efficient way to kind of save tens of hours. And so, yeah, the kind of in-person courses and bedside teaching are all very good for how to examine and elicit signs and seeing signs and being confident that you can elicit signs. But actually, by the day of the exam, most people are pretty good at this, and there's relatively low variability between candidates. How you put those signs together and synthesize things to reach your differential diagnosis and offer your investigation and management plan, there's very high variability between candidates. And this doesn't, excellent doctors don't necessarily do this well. This doesn't correlate with your ability as a doctor. It's a very specific skill that if you don't specifically target your learning towards, people can kind of trip up on the day of the examination if you haven't structured and focused your revision specifically to the scenario of the exam. And so the thing I always say at the outset is that if you haven't already seen the PACES website publishes the mark schemes that the examiners use. And so I'd really encourage everyone to, when you're presenting a case, to have an awareness of these mark schemes, and be thinking in your head of how you're kind of going through that and just making it as easy as possible for the examiner to tick off the marks for you. You know, your job on the day is to make it as easy as possible and remove any barriers to the examiner giving you full marks. So if you haven't already, check out the website for those mark schemes and kind of learn them and precisely what it is that the examiners are looking and assessing you on. But this is a very kind of broad summary of the things that you get marks for. You get points for physical examination and identifying physical signs. And as I say, kind of your bedside teaching and in-person courses will all be invaluable for that. People fall foul if they focus too much on this, and actually you need to be thinking about how you'll then present that, and to an examiner who's a complete stranger, who's never met you before, you've never met them before, and how in the kind of minute or two, like the few minutes that you have to debrief with them, you can impress upon them that yes, you're kind of solid, you understand neurology in a clear way and presents a clear differential diagnosis and management plan. But as I say, the differential diagnosis is kind of different in neurology because you're only examining a quarter of the nervous system at most. There are limitations with what you can precisely say about differential diagnosis, and so I go into quite a lot of depth about how to kind of conceive different signs and how to put them together and how to present them. You also get points for maintaining patient welfare, but I'd hope that, you know, with regular clinical practice, people are quite sensitive to this, certainly by the day of their PACES exam. Yeah, it's all about presenting things in a coherent way. And so many excellent doctors and candidates struggle with this steps. They might be excellent clinicians who identify all the signs and, you know, with a history can elicit and understand precisely what's going on. But just in the specific scenario of what an exam puts you in, they unfortunately struggle. And so I aim to try and help people kind of prevent them falling foul of the exam's own limitations, but in a way that also will benefit your kind of general understanding of it. Well. So that's why I've put together this Neurology PACES Essentials course. So it's a very broad overview. There's kind of four main categories that a lot of symptoms can fall within, plus a few additional kind of important things. So they're kind of broadly, I mean, there's a bit of overlap between these, and cerebellum and basal ganglia are also a part of the nervous system. So there's a bit of an artificial distinction, but broadly, teaching should be thinking about these four main categories. And I'd really encourage everyone to have a clear structure for thinking about, you know, if someone has a CNS issue, what is the differential diagnosis and what is the investigation and management plan to offer there? Similarly for peripheral nervous system, you know, you don't necessarily need the specifics of, you know, how a plexopathy might differ from a myopathy in presentation. That will all be very impressive, and I go into that in the course in a degree of detail, so that you can add that kind of flourish and show off to the examiner and really set yourself apart as an excellent candidate. You know, even when you've identified a peripheral nervous system, if you're thinking about, you know, where does it slot into the peripheral nervous system? You know, is it anterior horn cell? Is it nerve root? And then having just a way of thinking about presenting the common differential diagnoses and an investigation and management plan. And then there's quite a few conditions which are very rare in clinical practice and you'll probably never see on your kind of bedside teaching or in your real clinical life, but actually in the enriched PACES population may well come up. And I cover all of those as well. So the key will be that on the day you can really be focused on where is the issue, and you're focusing on the signs you're eliciting. And then once you've established where the issue is, you already have prepared before the day this template, which I'll outline about how to present each category. And so you have that structure prepared, ready for the day of the examination. So on the day you're thinking, where's the pathology? And you've done the groundwork before that to be able to fly when you have identified where it is. And you know, untargeted learning, trying to learn all this with quite an untargeted approach will waste tens of hours, as I did for my own kind of learning when I was doing PACES. But here I've tried to kind of condense things into a really kind of concise but comprehensive few hours worth of talks of the highest yield information, which is really tailored to the specific needs of the examination, but also giving a generally good approach for how to approach neurology in your general practice as well. It's not kind of boring, prolonged 3-4 hours lectures. They're digestible chunks that you can kind of pick them and go as you like, and you can repeat and rewatch things multiple times if you need to. And it's really all aimed to help target avoiding the common pitfalls which can trip people up. So as I say, the aim is to save your time significantly, kind of tens of hours of time that I myself wasted, but also doing the best you can on the day. So yeah, the kind of course in the link description, I'd implore you to have a look and see if you think it might be worth signing up.